Most people believe that routine medical tests are completely safe, nothing more than simple checkups to keep track of your health. But the shocking truth is that some of these tests, when performed in the wrong setting or on vulnerable patients, can quietly raise the risk of stroke, especially overnight when the body is least prepared to cope. As a brain doctor, I have seen patients who walked into the clinic for what they thought was a harmless routine test, only to end up with dangerous spikes in blood pressure, irregular heart rhythms, or oxygen drops that triggered a medical emergency hours later while they were sleeping. These are not rare horror stories. They are real events that remind us that even routine tests must be approached with awareness and caution. Imagine an older adult who undergoes a stress test to measure heart function. During the exam, their blood pressure surges. They feel dizzy, but the symptoms pass. Later that night, while resting at home, the strain on their arteries causes a clot to move toward the brain, leading to a stroke. Or consider a patient given sedatives for a sleep study. The drug slows breathing. Oxygen levels dip lower than expected, and the brain is starved of oxygen through the night. By morning, they wake up confused, weak, or unable to speak. These scenarios illustrate how hidden risks can surface from tests we assume are routine. It is important to understand that medical tests are powerful tools. They save lives, reveal hidden disease, and guide treatment. But like any powerful tool, they carry risks if not used carefully, especially in seniors whose blood vessels are already stiff, fragile, and prone to blockages or bleeding. The problem is not the test itself, but the lack of awareness about how it interacts with age, medications, and pre-existing conditions. What doctors may see as minor side effects can, in certain patients, set the stage for something as devastating as a stroke. That is why in this video, I am going to reveal 5 routine medical tests that can quietly raise your stroke risk overnight. I will explain exactly how they affect the brain, blood pressure, and circulation. I will also show you safer alternatives and share practical advice to protect yourself and your loved ones. Knowledge is your best defense. Because once you understand the risks, you can take steps to reduce them without avoiding the benefits of testing. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. And if you find this video helpful, type 1 in the comments. If not, type 0, so I know how to improve and bring you better content. Remember, not every test is as harmless as it seems. And tonight, it could make the difference between waking up healthy or facing a life-changing stroke. Part 1. Blood pressure stress test, the hidden trigger. One of the most common routine tests performed in hospitals and clinics is the blood pressure stress test, sometimes called the exercise stress test. On the surface, it seems harmless. You walk on a treadmill or ride a stationary bike while your heart rate and blood pressure are measured. Doctors use this test to evaluate circulation and detect heart disease. But what many seniors do not realize is that this test can also become a silent trigger for stroke if not managed carefully. When you exercise during the test, your body demands more oxygen, and your heart pumps harder to deliver blood throughout the body. For a healthy person, this is not a problem. But in older adults with stiff arteries, hidden blockages, or a history of high blood pressure, the sudden surge of blood flow can create dangerous pressure inside fragile vessels. This pressure can cause small plaques in the arteries to rupture. When that happens, a clot can form and travel to the brain, The result may be a transient ischemic attack, often called a mini stroke, or even a full stroke later that night. Another risk comes from the rapid fluctuations in blood pressure during and after the test. Seniors often have less flexibility in their blood vessels, meaning they cannot expand and contract as easily. So when the test pushes blood pressure to peak levels, the brain's delicate vessels are placed under enormous strain. Hours later, when the body is at rest, blood pressure can drop suddenly, leading to reduced blood flow to the brain. That combination of a previous spike and a later dip creates the perfect storm for stroke. Patients often report warning signs that should never be ignored after a stress test. Dizziness, sudden headaches, blurred vision, or weakness in one arm may appear mild at first, but are actually red flags that blood circulation to the brain has been compromised. The danger is that these signs sometimes appear after leaving the clinic, often at home or during the night. Seniors may dismiss them as fatigue from the exercise, when in reality the body is signaling that something serious is happening. Research supports this concern. Studies published in cardiology journals show that older adults who undergo stress testing, especially those with uncontrolled hypertension or diabetes, face a significantly higher risk of vascular complications in the 24 hours following the test. The majority recover without incident, but a small percentage experience strokes or cardiac events that could have been prevented with better preparation and closer monitoring. So what is the safe approach before undergoing a stress test? Always ensure your blood pressure and blood sugar are well controlled. Inform your doctor about any history of chest pain, arrhythmia, or previous stroke. During the test, insist on close supervision and do not push beyond your comfort level. Afterward, rest properly, hydrate, and pay attention to your body. If unusual symptoms appear, seek medical attention immediately instead of waiting until morning. If this surprised you, wait until you hear about the next routine test. One that is supposed to study your sleep but can quietly raise your stroke risk even more. Part 2. Sleep study with sedatives, a silent nighttime danger. Another test that seems harmless but can quietly raise your stroke risk overnight is the sleep study, also called polysomnography. It is a test designed to diagnose sleep apnea and other sleep disorders. During this study, sensors are attached to the body to measure breathing, oxygen levels, brain waves, and heart rhythm. For many patients, especially seniors, doctors sometimes prescribe a mild sedative to help them fall asleep in an unfamiliar hospital environment. While the intention is good, the consequences can be dangerous. Sedatives slow down brain activity and relax the muscles, including those in the airway. In younger and healthier people, this is usually not a problem. But in older adults with weakened respiratory muscles or pre-existing conditions like sleep apnea, the medication can make breathing dangerously shallow. Oxygen levels in the blood begin to drop, sometimes without triggering obvious distress. The brain is highly sensitive to oxygen deprivation, and even short periods of low oxygen at night can damage brain cells, increase clot formation, and raise the risk of stroke. The danger is magnified because sedatives can also suppress the body's natural alarm system. Normally, if your oxygen drops too low, your brain jolts you awake so you breathe harder. Under the influence of sedatives, this protective response is weakened or delayed. That means you could spend long stretches of the night in a low oxygen state without realizing it. By morning, you may wake up with a pounding headache, dizziness, or difficulty concentrating, not knowing that your brain has been under attack for hours. I have seen seniors who underwent a sleep study with sedatives and later experienced transient ischemic attacks or strokes within 24 hours. They thought they were simply tired from the hospital stay. But the truth was that the oxygen dips had stressed their vascular system to the point of failure. This is not common, but it is a real and preventable risk. Studies published in neurology and sleep medicine journals have confirmed that sedative use during sleep studies increases the likelihood of respiratory events and prolonged oxygen desaturation. In patients with existing cardiovascular disease, this desaturation is strongly linked to higher stroke risk. The combination of reduced breathing, impaired oxygen delivery, and increased blood pressure fluctuations during the night creates a perfect storm that may quietly trigger a stroke before dawn. So, what can be done to make this test safer? First, always discuss with your doctor whether a sedative is truly necessary. Many patients can still complete a sleep study without medication, especially if the room is prepared for comfort. Second, if medication must be used, the lowest possible dose should be chosen, and oxygen monitoring should be continuous with alarms in place. Third, seniors with sleep apnea or heart disease should have extra supervision during the night to catch early signs of distress. Finally, after the test, patients should be advised to rest under observation instead of being sent home too quickly. What you need to remember is this: the sleep study itself is not the danger, but the sedative combined with existing vulnerabilities can turn a routine test into a silent threat. If this part shocked you, wait until you hear about the next test. One that uses a contrast dye during imaging and may trigger vascular complications you never expected. Part 3. Imaging with contrast dye. The hidden risk in your veins? One of the most widely used diagnostic tools in modern medicine is imaging with contrast dye, such as CT scans or MRIs with injected contrast agents. These tests are considered routine in hospitals worldwide and are invaluable for detecting tumors, vascular blockages, or internal bleeding. Yet many patients, especially seniors, are unaware that these contrast dyes can place hidden stress on the brain and cardiovascular system, quietly increasing the risk of stroke. Contrast agents are substances injected into the bloodstream to make blood vessels and organs more visible on scans. The problem begins with how these agents interact with the vascular system. In many older adults, blood vessels are already stiff, narrowed, or inflamed from years of hypertension, diabetes, or high cholesterol. The sudden influx of contrast dye increases the viscosity of the blood and forces the heart to pump harder. This can raise blood pressure quickly and in fragile vessels. Even a brief spike can be enough to trigger vessel rupture or a clot moving toward the brain. Another hidden danger is the effect of contrast on the kidneys. Many dyes used in imaging are filtered out of the body by the kidneys. But in seniors with reduced kidney function, the dye lingers longer in the bloodstream. This prolonged exposure creates oxidative stress, damages the delicate lining of blood vessels, and increases the likelihood of clot formation. When clots form, they may travel silently and block arteries in the brain, resulting in an ischemic stroke hours after the scan. Allergic or inflammatory reactions to contrast dye, while relatively rare, also play a role. Some patients develop a sudden immune response that causes blood vessels to constrict. Vasoconstriction in the brain limits oxygen supply and can lead to severe headaches, dizziness, or even a stroke-like episode. Research in neurology journals has linked contrast-induced vasospasm with transient ischemic attacks, often mistaken as minor side effects of the scan. What makes this risk particularly concerning is that the stroke may not happen during the test itself. The patient leaves the hospital feeling fine, only to experience weakness, numbness, or slurred speech later that night while at home. Because the connection to the earlier imaging test is not obvious, many families delay calling for help, losing valuable treatment time. So, how can you lower your risk? The most important step is to always inform your doctor about any history of kidney disease, hypertension, diabetes, or prior reactions to contrast agents. Simple pre-test blood work to check kidney function can help doctors decide whether contrast is safe for you. Hydration before and after the scan reduces stress on the kidneys and helps flush the dye out more quickly. For high-risk patients, doctors can consider alternative imaging methods that do not require contrast, such as ultrasound or non-contrast MRI. Imaging with contrast dye is a powerful tool, but it is not without risks. For seniors, the combination of stiff vessels, vulnerable kidneys, and underlying disease can make this routine test a hidden danger. If this surprised you, wait until you hear about the next test. One that does not involve dye or drugs, but can suddenly alter blood pressure and circulation in a way that quietly sets the stage for stroke. Part 4. Tilt table test, when circulation turns against you. Another routine medical procedure that many seniors undergo is the tilt table test. Doctors often use this test to investigate fainting spells, dizziness, or unexplained drops in blood pressure. On the surface, it sounds simple. You lie flat on a special table, and then the table is tilted upright to see how your blood pressure and heart rate respond to changes in position. But what appears to be a safe evaluation of circulation can, in some people, turn into a hidden trigger for stroke. The tilt table test works by stressing the body's natural reflexes. Normally, when you move from lying down to standing, your blood vessels constrict slightly to keep blood flowing to the brain. In seniors, however, this reflex is often impaired due to stiffened arteries, nerve dysfunction, or years of uncontrolled hypertension. When the table tilts, blood may suddenly pool in the lower body, starving the brain of oxygen. Rich blood, for some, this leads only to dizziness or fainting, but in others, the sudden drop in cerebral blood flow can trigger a transient ischemic attack or even a full stroke. The danger does not stop there. In certain patients, the tilt table test causes the opposite reaction. Instead of blood pressure dropping, the nervous system overreacts, causing blood pressure to spike sharply. This sudden surge places fragile blood vessels in the brain under extreme strain. If a weakened vessel ruptures, a hemorrhagic stroke can occur. Although rare, such cases have been documented in medical literature, particularly among elderly patients with pre-existing vascular disease. Another risk comes from arrhythmias triggered during the test. Shifting blood flow and changes in pressure can disturb the heart's electrical system, leading to irregular rhythms. In seniors with a history of atrial fibrillation or heart disease, even a brief arrhythmia can promote clot formation. Those clots may not cause immediate symptoms, but hours later, often during sleep, they can travel to the brain and block a vital artery. The result is a stroke that seems to strike out of nowhere, but was actually set in motion by the earlier test. Patients often dismiss the warning signs that appear after a tilt table test. Fatigue, confusion, or lingering dizziness are brushed off as side effects of the procedure. In reality, these can be red flags that circulation to the brain has been disrupted. Failing to act quickly when these symptoms arise is one of the reasons strokes following this test can be so devastating. So, how can you reduce your risk? Always ensure the tilt table test is performed in a hospital setting where immediate medical support is available, not in a small clinic without emergency equipment. Make sure your doctor reviews your heart rhythm, blood pressure history, and medication list before recommending the test. Seniors with uncontrolled hypertension, severe artery disease, or recent strokes should be evaluated very carefully before being exposed to this procedure. The tilt table test can be useful for diagnosing fainting and dizziness. But for seniors, the risks cannot be ignored. What seems like a harmless tilt may silently trigger dangerous changes in blood flow that raise stroke risk overnight. If this part worried you, wait until you hear about the next routine test. One that involves nothing more than blood samples, but can still carry hidden dangers for your brain. Part 5. Routine blood test with clotting assessment, a subtle but serious risk. When people think of routine medical tests, blood work is usually the first thing that comes to mind. A quick needle prick, a few tubes of blood collected, and the results provide doctors with a wealth of information about your health. It sounds completely safe. And for most people it is, but certain types of blood tests, especially those that involve clotting assessment or repeated sampling, can create hidden risks that quietly raise the chance of stroke, particularly in older adults. Blood clotting tests, often called coagulation profiles, measure how quickly your blood forms clots. These tests are important for monitoring conditions like atrial fibrillation, deep vein thrombosis, or for patients taking blood thinners such as warfarin. The danger lies in how these tests interact with medications. For example, if your blood is too thin because of excessive anticoagulation, even a small bleed inside the brain can become catastrophic. On the other hand, if your blood clots too quickly, the risk of a clot forming in a vessel and traveling to the brain increases. This delicate balance means that errors in dosing or monitoring can tip you toward stroke risk without you realizing it. Another risk comes from repeated blood draws in frail seniors. While taking blood itself does not directly cause stroke, the stress response it triggers can, for older adults with fragile vessels, the anxiety, pain, or even minor dehydration from fasting before the test can cause blood pressure to rise sharply or drop suddenly. These fluctuations place additional strain on the brain's circulation. In rare cases, they can set the stage for transient ischemic attacks later in the day or overnight. I have seen patients who underwent routine coagulation testing and ignored warning signs afterward. A sudden, severe headache, dizziness, or unusual bruising were dismissed as minor inconveniences. Hours later, they developed slurred speech or weakness on one side of the body. By the time they reached the hospital, the damage had already been done. The connection between the earlier blood test and the stroke was overlooked. But in reality, the disruption in clotting balance had triggered the event. Studies in medical journals have shown that patients on anticoagulation therapy are at significantly higher risk of both ischemic and hemorrhagic strokes if their medication levels are not closely monitored. Even a small deviation from the target range can double or triple the risk. That is why routine blood tests, while life-saving when used correctly, can also become dangerous if results are misinterpreted or follow-up is inadequate. What can you do to protect yourself? First, always keep a detailed record of your medication doses and recent test results. Do not rely solely on memory. Second, never skip scheduled blood tests if you are on anticoagulants, because skipping increases the chance that your levels drift out of the safe range. Third, if you experience unusual symptoms after a blood test and a B, no matter how mild, contact your doctor immediately. Small changes in speech, vision, or coordination may be the earliest warning signs of a developing stroke. Routine blood tests remain one of the most common and valuable medical tools. But in seniors, especially those taking blood thinners or clotting medications, they carry risks that cannot be ignored. If this surprised you, wait until you hear about the safer alternatives that doctors can recommend to monitor your health without putting your brain in unnecessary danger. Part 6. Safer alternatives, tests with lower stroke risk. After hearing about stress tests, sleep studies with sedatives, imaging with contrast dye, tilt table tests, and clotting assessments, you may feel discouraged or even fearful of medical testing. But let me reassure you, these tests can be extremely valuable when used correctly. And in many cases, there are safer alternatives that reduce risk while still giving doctors the information they need. Knowing these alternatives empowers you to ask better questions and make safer choices for your health. One of the most effective alternatives for monitoring circulation and heart function is the ambulatory blood pressure monitor. Instead of putting your body through a stress test that can spike blood pressure, this device records blood pressure over 24 hours while you go about your normal daily activities. It gives doctors a more accurate picture of your real-life blood pressure patterns and eliminates the risk of sudden overexertion that can trigger vascular problems. Another safer option is the Holter monitor or event monitor, used for tracking heart rhythms. Instead of a tilt table test that artificially manipulates your circulation, these small wearable devices continuously record your heart's electrical activity. If arrhythmias or dangerous rhythms occur, they can be detected without putting your body through the stress of rapid position changes. This not only avoids dizziness or fainting, but also reduces the chance of circulation disruption that can lead to stroke. For patients who need imaging but are at risk from contrast dyes, non-contrast MRI scans and ultrasound studies provide safer alternatives. Carotid ultrasound, for example, uses sound waves to visualize the arteries in the neck, detecting blockages that could lead to stroke. It is painless, non-invasive, and carries no risk of dye reactions. Non-contrast MRI techniques can also provide detailed images of the brain and blood vessels without exposing patients to kidney strain or allergic complications. When it comes to sleep evaluation, instead of relying on sedatives during a sleep study, doctors can now prescribe home sleep apnea tests. These portable devices allow you to sleep in your own bed while monitoring oxygen levels, breathing patterns, and heart rate. Without sedatives, the results may even be more accurate, and the risk of oxygen desaturation leading to stroke is far lower. For patients on blood thinners who need regular monitoring, point-of-care testing with fingerstick devices can often replace repeated blood draws. These tests are quick, less stressful, and can be performed more frequently, ensuring your medication levels stay in the safe range. Some newer anticoagulants do not require regular monitoring at all, offering another layer of safety for seniors concerned about clotting risks. The key message here is not to avoid testing altogether, but to understand that safer alternatives exist. By asking your doctor about these options, you can protect your brain, heart, and overall health while still benefiting from modern medicine's diagnostic power. Always remember, the right test at the right time can save your life, but the wrong test in the wrong setting can put it at risk. If learning about safer options gives you hope, stay with me for the next part, where I will share practical advice every senior must know before saying yes to any test. These simple steps can dramatically reduce your risk of stroke and keep your brain safe. Part 7. Practical advice: how to stay safe during routine testing. Now that you know which routine tests can raise stroke risk and what safer alternatives exist, it is time to focus on what you can do to protect yourself. The truth is, routine tests are not going away. They are necessary for diagnosis and treatment. But you can take practical steps to lower the danger, especially if you are a senior or already dealing with conditions like hypertension, diabetes, or heart disease. The first step is communication with your doctor. Never walk into a test without making sure your doctor is aware of your full medical history. Tell them about any strokes, mini strokes, arrhythmias, kidney problems, or breathing issues you have had. Mention all medications, including over-the-counter drugs and supplements. This information helps your doctor decide if the test is safe for you or if a safer alternative is available. The second step is preparation before the test. For example, if you are scheduled for a stress test, make sure your blood pressure and blood sugar are well controlled. If you are undergoing imaging with contrast dye, drink plenty of water before and after the scan to protect your kidneys. If a sleep study is necessary, ask whether it can be done without sedatives or at home instead of in a lab. Preparing your body reduces the strain these tests place on your brain and circulation. The third step is monitoring during the test. Never assume the staff will catch every problem. Pay attention to how you feel. If you notice dizziness, chest discomfort, sudden headaches, or vision changes, speak up immediately. These are not minor side effects. They are warning signs that your brain or heart may be under stress. It is always safer to stop the test than to push through and risk a stroke. The fourth step is observation after the test. Many complications from routine tests do not occur immediately, but hours later, often at night. If you experience unusual fatigue, confusion, numbness, or difficulty speaking, do not dismiss it. Seek medical help right away. Remember, strokes can develop silently in the hours after the stress of a test. And early treatment is the difference between recovery and permanent disability. The fifth step is regular follow-up. Tests like clotting assessments only help if results are monitored and acted upon quickly. Make sure you understand what your results mean and what changes to your medications are necessary. Do not leave the clinic without clear instructions. Finally, the sixth step is advocacy for yourself and loved ones. Seniors are often told tests are routine, but you now know routine does not always mean safe. Ask questions, request alternatives, and insist on close monitoring. The more proactive you are, the safer you will be. Routine tests are designed to protect your health, but without awareness, they can introduce risks you never expected. The good news is that with preparation, communication, and vigilance, you can minimize those risks and protect your brain from stroke. In the conclusion, I will summarize the key lessons and remind you why being informed can save your life. Conclusion: protecting your brain from hidden test risks. We have now reached the end of this important discussion, and I want to leave you with one clear message. Routine medical tests are not always as harmless as they seem. Blood pressure stress tests, sleep studies with sedatives, imaging with contrast dye, tilt table tests, and even routine blood clotting assessments can all quietly raise your risk of stroke, especially overnight when your body is most vulnerable. These procedures were designed to diagnose and protect, but without awareness, they can sometimes do the opposite. The truth is that seniors are more fragile than they may appear. Years of hypertension, diabetes, or vascular disease make blood vessels stiff, narrow, and prone to damage. A sudden spike in blood pressure, a drop in oxygen, or a shift in circulation caused by a test may be enough to tip the balance. Strokes that follow routine testing are not always immediate. They may strike hours later, often in the quiet of the night, when help is far away and every minute matters. But here is the hopeful reality. By being informed, you can dramatically lower your risk. We discuss safer alternatives, like ambulatory blood pressure monitoring, Holter devices, non-contrast imaging, home sleep studies, and point-of-care clotting tests. These options give doctors the information they need without exposing you to unnecessary risk. And even when the riskier tests must be done, preparation, close monitoring, and early action can turn a potentially dangerous situation into a safe one. Your role as a patient is not passive. You have the right and responsibility to ask questions. Tell your doctor about your medical history, your medications, and your concerns. Request safer options when possible. Insist on proper monitoring during and after the test. And most importantly, never ignore the warning signs that your brain is under stress. Headaches, dizziness, speech difficulties, weakness, or confusion are not minor complaints. They are red flags that need urgent attention. I have seen too many seniors suffer strokes that could have been prevented if these steps had been taken. That is why I am sharing this message with you now. Knowledge is your shield, and vigilance is your protection. Routine tests can save lives, but only if they are done safely, with your brain and heart in mind. So tonight, when you reflect on what you have learned, remember this. Your body still remembers how to heal, but it needs you to make wise choices. Do not let routine become a silent risk. Protect your brain, protect your independence, and protect your future. Now, I would love to hear from you. Which of these tests surprised you the most? Which safety step will you take the next time your doctor recommends a routine check? Type 1 in the comments if this video gave you valuable knowledge. Or type 0 if you want me to improve. Share this video with someone you love, because the life you save may be theirs. And do not forget to like, share, and subscribe so you never miss another health tip made just for you.